The cool weather of the fall tends to bring a whirlwind of scheduling conflicts, appointments, school, and work. This time of year can often lead to unwanted stress or anxiety. TGMC would like to discuss the dangers of too much stress and how to better manage it.
All right, welcome to Your Health with Terrebonne General Medical Center. I'm Martin Faust, and our guest tonight is Dr. Nicole McKee. And Doc, thank you so much for joining us tonight. We appreciate it.
Thank you for having me.
Now, we're going to talk tonight about something that nobody wants, but everybody has. So first of all, what is stress?
Well, stress entails a lot of things, but it's your basic body's response, physiologic and psychologic, to the demands of life. And stress can manifest itself in many ways, but basically when your body or your brain perceives a threat or an event, it just secretes a flurry of hormones, and those hormones are to prepare you for that flight or fight response. And in most situations, when the threat is gone, you should be able to return to a normal, relaxed state. But in today's world, it's always on the go. A lot of people find it really difficult to relax.
Yeah, I guess so. It's the 24-hour stress cycle, so to speak. But give us some examples of what causes stress in people that you've seen throughout the years.
Stress triggers can be many, and they can be very different. They can be both positive and they can be negative. Some of the more negative events that we tend to see are going to be job pressures, financial troubles, marital troubles, and stressors can also be positive, the purchase of a new home, the birth of a new baby, or a marriage.
Now, when you talk physically about the body, different people react differently to stress, but on the effects to the body, what would they be?
Well, normal symptoms, or not, I shouldn't say normal, a lot of symptoms of stress can be physically manifested. Some people experience symptoms of stress as just a feeling of anger or frustration or an inability to cope, but some people also do feel physical symptoms, and that can be a fast heart rate, a feeling of inability to breathe properly. You can get tremors, shaking episodes, sweating, stomach upset. All of those can be common symptoms of stress.
Okay, now, a person mentally, on the flip side, stress has different factors. What would they be for that?
Well, mentally, chronic long-term stress can definitely wear away at your mental health. And that long-term chronic stress can lead to problems with chronic depression and anxiety. It can lead to eating disorders. It can lead to problems with infertility, all of which will affect your normal, good mental health.
A lot of times people use the word stress and anxiety together. Are they synonymous or are they different?
There really is a difference between stress and anxiety. Stress is really the event. It is what makes you feel on edge or a feeling of inability to cope. And it is tied to a specific event or events that make you feel this nervousness. And it is not persistent. Anxiety, on the other hand, is persistent. It's more of a chronic feeling of uneasiness or impending doom. And in a lot of people, they don't even have the ability to identify what's causing that. And that actually leads to increased distress as well. Anxiety can be a medical problem that's diagnosable and treatable.
All right, very good. We appreciate that. We're halfway through. We're going to take a break and hear from Terrebonne General Medical Center. And when we come back, more questions for Dr. McKee. Don't go away.
Think of 6 men you know. One of them will get prostate cancer. Early detection can save a life. Make an appointment with the experts. Mary Bird Perkins Cancer Center at TGMC.
Put together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
All right, there's our guest again, Dr. Nicole McKee, family practice physician, and we're talking about stress management. And let's jump to the next question. The symptoms of anxiety. Can you give us a few of those?
Sure. And again, symptoms of anxiety can be similar to symptoms of stress, but it's more long-term. And they can be feelings of feeling powerless, apprehension, feeling of doom. They can also be sweating, a feeling of rapid breathing, rapid heart rate. You can have trembling, feeling weak and fatigued, insomnia, and even thoughts of suicide.
Okay. Now, for those watching that are hearing you and experience this, but they want to manage it, how do they do that?
Well, there are certainly multiple techniques for managing stress. One of the first and most important things to do is to figure out what your stress triggers are. And it is important to remember that stress triggers can be negative and positive, so you need to identify both of those. There are many activities that can help you to reduce daily stress, and that might be practicing Tai Chi, meditation, yoga, or some kind of formal exercise program.
But just to deviate a little bit, you don't want to release all stress because some of it, like you said, is good.
There is some good stress, and what your goal is to learn how to manage that stress and to deal with it.
Okay, now the easy relaxation techniques, you mentioned a few things to do, but is anything easy that I can do during work, for instance?
There are certainly easy things that you can do. There's a couple of relaxation techniques that we recommend. And the first is called autogenic relaxation. And basically, it is using your own mind and your own imagery to feel at ease. And it might be a series of phrases or words that you repeat to yourself, imagining yourself in a calm place, and just trying to slow your breathing and to slow your heart rate to relax.
So the word hum comes
that
from
might
somewhere,
work.
Right? All right. The benefits of relaxation techniques, what can it do overall for a person?
Well, relaxation techniques are very important because if you don't employ those, you get to the point where you can't tolerate any of life's little pressures, and you need to take time to relax. Relaxation techniques have been proven to increase blood flow to your muscles, to improve concentration, and improve your overall sense of well-being.
Okay. Now, the exercise debate has been going on for years and years and years, but does exercise really help stress and anxiety?
Stress absolutely helps stress and anxiety. Exercise does. What exercise does for you is, first and foremost, it improves your sense of well-being. Your body naturally releases hormones with exercise called endorphins, which help you to alleviate stress. And in a lot of cases, exercise, especially done with other people, is very beneficial because it allows you to have those interactions and those other people to help with those stress management techniques.
All right. So when you go to the LSU game, final question before we get the graphic up, and you're a big Tiger fan, but you're having fun at the game, but we get down to the fourth quarter, and they're down by one and they're going to kick a field goal. Stress level goes up, right?
Right.
But that's a good stress, right?
That's a good stress. But it
you know
can still make you feel bad.
Well, all right, Dr. McKee, thank you so much for coming on board. And we're going to bring up a graphic now. For more information, you can call Terrebonne General Medical Center's Outreach Center at 858-7020 or log on to tgmc.com. Thanks again, Doc. We appreciate you being on.
Thank you. Thank you very much.
All right. And we'll take a break. When we come back, more in Bayou Time. Don't go away.